everyone, I'm Dr. Madhavi, Consultant Dermatologist, Hyderabad. Let us talk on psoriasis. What is psoriasis? Psoriasis is a chronic skin problem affecting the skin. So what are causes? అసలు ఎందుకు psoriasis వస్తుంది? దానికి గల కారణాలు ఏంటి తెలుసుకుందాం. Psoriasis, there are multiple causes, but still they are still pursuing. The definitive cause is not known. Genetics play a definitive role. So if there is a family history of psoriasis, both paternal side or maternal side, the incidence of getting to the next generation is about 40%. Second is the lifestyle changes. Obesity, smoking, alcohol, rheumatic disease, and other skin problems or other autoimmune disorders, if they can be associated with psoriasis. What are the different types of psoriasis? So there are different varieties of psoriasis. The psoriasis affecting the scalp, resulting in scaly powdery form, like it just looks like a dandruff. That is called scalp psoriasis. Psoriasis affecting the body, that is called the plaque psoriasis. Psoriasis affecting the nails, nail psoriasis. Sometimes the psoriasis can be widespread, that is, it can affect the entire part of the body. It can result in erythrodermic psoriasis. And many a times, psoriasis will be linked up to the joints also. So the patients will complain of joint pains, mainly the knee joint or the back spinal cord, spine joint. These are the joints commonly affected and they complain with pain. So they are calling psoriasis affecting the joints. So as we have discussed, so the psoriasis can result in different forms. Sometimes the psoriasis can just limit itself to the arms and soles. That's called as a palmoplantar psoriasis. Who are the best people who can guide you or diagnose psoriasis? Definitely the dermatologists are the right persons to diagnose your problem. So whenever you suspect a scaly skin plaque, and then a powder form powder form if it comes, in such a scenario, you should always think about psoriasis. So once you approach a dermatologist, the dermatologist, depending on your symptoms or signs, ekkada problem undi ani telusukunna tarvata psoriasis another they will confirm it. Many a times, even the dermatologist itself, they find it difficult to diagnose it. In such a scenarios, they will be doing a skin biopsy. So a small bit of skin will be taken and they will be sent for microscopic examination to diagnose the problem. And nowadays, the latest tool is called dermoscopy. So we use the dermoscopy. With this specific tool, we try to diagnose the psoriasis. We have our own features. So after diagnosing it is a psoriasis, what are the next line of management? So usually the psoriasis treatment depends on the degree of involvement, the body surface involved. Sometimes the skin problem, the psoriasis will be limited only to the knees, only to the elbows or only to the scalp, very restricted. That we call as label as mild degree of psoriasis. In case of mild degree of psoriasis, they usually give only the topical creams. What is the main reason for the scaliness? What is the main reason for pottu? Enduku vastundi asalu main pottu? So the main reason, usually we have the two different layers in the skin. One is epidermis, second is the dermis. So epidermis will again have 5 parts. So the basal, the bottommost layer of the skin, that is especially the epidermis, the cell generation will take place as it comes from the bottom to the top layer. So as a result, the dead skin will be gone off. This is called as cell turnover. Normally it takes about 28 days for the cell turnover. But in psoriasis, only in a span of 3 to 4 days, the cell turnover will happen. So as a result, however you try to pick up the scales, however you try to take up the scales, again it will generate. As a result, it keeps on resulting in scaly plaques. So pottu ga ralutu untadi. Then polusu vyadi antaru. So this is the main reason for the why repeated attacks of this scaliness happens in psoriasis. So we have to target the scaliness, that's the plaques, scaly plaques. How? By using the moisturizing creams, we can control the formation of the scales. To some extent, we can forbid it, we can cover it. So moisturizing is the first step which we suggest. Second is the anti-inflammatory creams. What are the commonest anti-inflammatory creams which we guide? Is the corticosteroids. So steroid creams. As I mentioned in the first beginning of the presentation, that is, psoriasis is a chronic autoimmune disorder. అంటే ఎక్కువ రోజులు ఉండే ఇన్ఫ్లమేషన్ సంబంధించిన ప్రాబ్లం. సో we give corticosteroids which are anti-inflammatory medicines. ఈ corticosteroid will suppress the inflammation. ఒక డిసీజ్ వచ్చింది అంటే there is some inflammation is happening on. It's not infection. So moisturizers as well as corticosteroids are commonest for the first degree of or mild case of psoriasis. And many a times there are some hypotheses where omega-3 fatty acids deficiencies can aggravate psoriasis. So we along with this topical preparations, we suggest the patients omega-3 fatty acids, both in the form of diet as well as in the capsule form. So these are the three important which we usually prescribe to mild degree of psoriasis. Second is the moderate grade, that is moderate psoriasis. So in case of moderate psoriasis, where the psoriasis is affecting for a larger body surface area. So and sometimes even in case of mild degree psoriasis, the patients will feel so depressed. They cannot expose themselves to the outside environment. They feel very depressed. Even in such a scenarios and in moderate cases where the body surface is involved in a larger extent, we go to the second regimen. So along with the topical preparation, along with omega-3s, we suggest to go for narrowband UVB therapy. This narrowband UVB therapy is called phototherapy. So as I have mentioned, the cell turnover has been decreasing in case of psoriasis. So this narrowband UVB therapy, the phototherapy, will target the cell turnover, exact pathogenesis. Either main mukhya karanama, dani target chestadu. As a result, all the stacky layers of the psoriasis, they can be controlled. To come around weekly 3 times, alternate days or twice a week. We advise them along with topical medication. Next is the severe variant. When the body surface area is involved to a major extent or the patient is psychologically depressed, we go to the third line of management. So along with the first line, second line which I have mentioned, we have to use immunosuppressants. From the beginning, I was trying to focus more on autoinflammation. Since the process is going on is called as autoinflammation, we have to give immunosuppressants to control the psoriasis. So we have immunosuppressants like methotrexate, cyclosporin, mycophenolate mofetil, azathioprine. There are so many good medicines which are available to treat the psoriasis. But you have to take a word of precaution or a caution when we are using these medicines. So try to approach the doctor, dermatologist. So the dermatologist will find out whether the person or the patient is healthy in terms of renal function test, that is the kidney function test, liver function test, the basic CBP-ESR, that is called the complete blood picture, liver function test. So like basic parameters we try to evaluate and see whether she or he is fit for the medicines, and then we try to prescribe the immunosuppressants. Once the patient starts using the immunosuppressants, within 4 to 6 weeks, the patient will have very good improvement in the decreasing in the lesions, both in the form of the thickness of the plaques will reduce, the nerve lesions will not form, and he gets clinically better. But many a times, patients, once they find out that he or she is improving, they try to stop the medicines. But that is not the way which we have to follow. So there will be like a course. How we exactly follow the protocol for diabetes, that is sugar, hypertension is a BP. Similarly, we have to follow the same protocol even for psoriasis. Because 1 month or 2 months use chesi మన medicines ఆపేస్తే immediately గా మన psoriasis తిరగబడిపోతుంది. But if we use like a course like 1 year or 6 months course, if you use it, most of the time our disease will be under control. So in this way, ఎక్కువ రోజులు for a long period of time, we can make the patient disease free. So we have to remember these important points. Second is the many a times patients feel that ఒక్కసారి స్కిన్ ప్రాబ్లం వచ్చింది అంటే whether it's contagious, whether it's spread to the family members or not. That's a major thing which people ask. So disease is absolutely not contagious and every sokadu. Psoriasis another, it is limited for the patient himself or herself. So it will not spread to others. It is not contagious. So you can firmly assure your relatives or your family members ఇది అంటువ్యాధి కాదు, and you can have a very good family life. Second thing is, and the most of the time they have that kind of feeling that whether the children are going to get the psoriasis, any preventive measures we can follow such that we can prevent the next generation. But usually most of the diseases which we have discussed till now, whether it's psoriasis or diabetes or hypertension, we cannot exactly assure the patient that you are not going to get it or you are going to get it. We cannot assess. It depends on your lifestyles, your genetic tendencies and so on. So always try to have a good healthy lifestyle. Try to control your weight. According to your height, your body mass index should be maintained. Your lifestyles like smoking, alcohol, if in case are there, you have to quit it. And time meditation with yoga will definitely control your stress levels. By controlling the stress levels, your psoriasis will come down. So these are important lifestyle parameters where you have to keep in mind, and the timely maintaining of the meals, especially eating good habits. Fresh fruits and vegetables should be incorporated. Non-vegetarian food should be controlled. Omega-3s to be incorporated more in the diet. Regular using of moisturizing creams, timely sleep patterns, all these factors will control your psoriasis in a better way. And regarding other modalities, treatment modalities, there are very advanced treatments have been available apart from what we have discussed now. They are called as biologics. So biologics people have been using in the Western world with a very good response to the patient, and patients are very happy with that. Only thing is, patient compliance is very important. So, one more thing is, biologics are relatively little expensive compared to whatever I have discussed till now. But for a long period of time, the patient disease will be under control. So, biologics usually similarly how we have explained regarding the immunosuppressants, some protocol and basic parameters. We advise the patient to go for some investigations. Once the patient is fit for that, we usually make the patient admitted, and we give the biologics in form of injectable forms. So the advantage of these biologics is that every day using the tablets in the oral form will be minimized, better result with less side effects will be expected from the point of view. So this is in brief about psoriasis. If you have any more doubts regarding the psoriasis, you can be very free and comfortable. You can communicate via the WhatsApp or email to me. And any more relative to the psoriasis, if you have queries, please be comfortable. Always try to approach the dermatologist because they're the right persons to guide you. Don't over self-medicate, because many a times psoriasis will just mimic like a simple skin eczema or some fungal infection or some viral infection. We don't know. We just go to the medical shop, we try to purchase the cream and we try to apply it. In such a scenario, we cannot diagnose, because the initial signs of the disease will be masked off. So when the initial signs of the disease is masked off, even the dermatologist will find difficult to find out the cause. Whether it is really psoriasis or not, we cannot diagnose it. So please don't try to self-medicate. Most of the times, if you are not approachable to the dermatologist, or if you don't have the time to approach, try to use moisturizers for time being. But don't use self-medicated creams, medicated creams taken from medical shops and try to apply and make it more worse. And as I mentioned, even the scalp psoriasis will look almost like a dandruff. Many times people think that this dandruff, why it is not going. So when you feel that the clots are there on the scalp and repeatedly it is coming like a dandruff with lot of white powdery substances falling on the shirt as well as on the top of the dress, if you feel that and you have the doubt, always suspect of psoriasis, get a confirmation from the dermatologist. Try to use the medicated creams or the lotions or shampoos prescribed by the dermatologist and use it.